Deuk laser disc repair is the best laser spine surgery. Why? Plain and simple. No bone cutting. Other spine surgeons that use a laser procedure cut or drill your spine to access the damaged disc. While they may temporarily relieve the pain, drilling holes significantly weakens and destabilizes the spine, further damaging your back or neck. Fusion surgery with screws and rods becomes the only solution to this problem. If bone is removed from your spine, be prepared for the likelihood of a spinal fusion in your future.
I do have my back problem, and I contacted the Laser Institute in Tampa, which did a laser procedure on me, which later on shows something went wrong. And I getting worse, I could hardly walk in anything at the end. Then I contacted Dr. Deuk in Titusville, and he went through everything with me and explained it, and he found out there was something wrong. In Tampa, they cut some piece of my bone structure off, which later weakens the whole system, which later Dr. Deuk repair.
My previous surgery was at Neuro-Spine Institute, and I have good things to say about them, the way that they treated everyone and all. They had cut a little too much bone from the vertebrae, and so that caused other problems. I could hardly walk, and it got worse and worse, and it was getting worse fast. So I did something that I'm really surprised I did. I went online and found Dr. Deuk.
Deuk laser disc repair eliminates the need for cutting bone, leaving your spine intact.
I'm Dr. Deuk, and I'm here today to tell you about a revolutionary new surgery we've developed for treating herniated discs in the lumbar spine. These herniated discs frequently cause back and leg pain. Traditional treatments involve drilling holes in the back of the spine. Those holes that are drilled can cause weakness of the spine, destabilizing the spine. Therefore, those patients will need a fusion surgery in the future. With my revolutionary new treatment, the Deuk laser disc repair, we're able to treat herniated discs without having to remove bone from the back of the spine.
Using state-of-the-art proprietary techniques and through only a 1/4-inch incision, Deuk laser disc repair uses an endoscope to gently separate muscle and ligaments to repair the herniated disc with a precise laser. This outpatient procedure repairs the damaged disc without cutting bone and compromising the stability of your spine. And our results speak for themselves.
I felt immediate relief of pain. Immediate.
It's amazing the difference from one day to the next. I had my surgery yesterday. I woke up this morning and I felt like, wow, I could just go start my full day. You know, I felt like I could just go back to work or whatever.
So I came down here to have the surgery, and the surgery was yesterday, probably 26 hours ago, and I feel great.
Our Deuk laser disc repair patients are usually pain-free without medication, driving, and in many cases, back to work the day after surgery.
The surgery was done yesterday at about 1 o'clock yesterday. I was out of there by 4 o'clock, and I'm on the job site by 9 o'clock the next morning.
The next day, I went to work. I was driving, and I was walking.
I could stand up and do the dance if you want me to. If I had a job, I would go to work, but I have no pain, none whatsoever. Just 24 hours ago, I'm a total different person.
Call the Deuk Spine Institute now for a free personal consultation with a surgeon and find out how you too can be pain-free.